actually what was amazing to me as I did get rejected the first few times I submitted the book was, one of the answers that the publishers asked is what books out there are like this book? And there's no other book, right, that does the clinical care of African Americans. There's none other. And so it's like no competition. And 44 million African Americans. So, and I told one of the publisher, I said, you have a book on a diagnosis that occurs to 8,000 people a year. You have a book on that, right? But you can't have a book on the healthcare of adults, over 30 million. It was just amazing to me. And so there is not a lot of research out there. And I think what drove it is this patient-centered, it's not about being culturally competent. I think a lot of people thought, or just culturally aware or, things like that. There's some aspect of that, but this book is just about, with the labs, what's the risk? What sort of cancer do you get? What sort of cancers don't you get? What sort of diseases do you get, and what sort of diseases, don't you get? And so I don't know of any other other books out there that are specific for. I know there's no other specific for African Americans, but there may be some others specific for other populations.